It's been perfectly wonderful being here in Durham, and I'm always grateful for the opportunity to trot out some of my hobby horses. I have a whole barn full of them, and I'm going to be talking to you primarily about moral injury, which is my baby. For 20 years, I worked in a U.S. Department of Veterans Affairs clinic where all of my patients were combat veterans with severe psychological and moral injury. And in a moment, I will get more precise on these locutions, psychological injury and moral injury. But I need to say that my patients beat out of me any inclination at all to speak like a god from the edge of the universe, an unlocated voice, the voice of the expert. This talk will be in my voice, which is the voice that I learned I must use with them if they were to even begin to consider trusting me. So I no longer inhabit the edge of the universe voice of the expert. You're hearing me. So for about 15 of the years I spent in the clinic, and continuing now quite steadily after retirement from clinical work, I have also worked with active military forces, not as a clinician, but as an advocate for changes in policy, practice, and culture which would prevent psychological and moral injury. So at the risk of being seen as boasting, I do want to just tick off some of the venues that I have had, which honestly astonish me. I'm amazed that I have had as much of a hearing as I've gotten. In 99 and 2000, I did the Commandant of the Marine Corps Trust Study. That's not an acronym, it's the word trust, for the Marine Commandant General Jones at his direct personal request. Then I continued much the same, developing much the same work with the utterly grand title, Chair of Ethics, Leadership, and Personnel Policy in the Office of the U.S. Army Deputy Chief of Staff for Personnel. I didn't even get a business card made because I was afraid it would have to be the size of a placemat. And then the other major paid gig was as the Omar Bradley Chair of Strategic Leadership at the U.S. Army War College in 2009. But I function also as an unpaid missionary to the forces on prevention. I always present myself, I'm a missionary from the veterans I've served. They don't want other young kids wrecked the way they were wrecked. So listen up, this is what they've taught me. And it's a surprisingly successful posture for me. I'm a bearded civilian for much of my adult life. Barney Frank's district in Massachusetts. Those of you who hear echoes of the American news will be aware that Barney Frank for many, many years was the only openly gay member of Congress. So there's something novel about the bearded psychiatrist from Newton, Massachusetts, speaking to, actually one notable speaking gig was in the Naval Command Center in the Pentagon. It was an auditorium about this size. except with great thick doors, because they held classified briefings in this auditorium. And it was literally full with Navy admirals and Marine generals, as well as a scattering of secretaries, undersecretaries, deputy undersecretaries, under-deputy secretaries of the various military services. And I do get a hearing. And I get a hearing also from, I spoke once to a whole much larger auditorium of Marine corporals. And I can tell you it was a goosebump moment to be mobbed in the foyer outside the auditorium by corporals wanting me to sign their copy of Achilles in Vietnam. I still get goosebumps when I think about that. So anyway, since I am speaking to you in my own voice, there will be some thuds when I jump from one level of diction to another, and you'll know when they happen. So I have been astonished and profoundly enlightened and moved by the Homeric narrative fictions because of their qualities as experiments with the moral materials of war, the moral materials of their society and the way they made war, and what Aristotle called poetry could well be spun as simply fiction. And all of the best fictions are experiments with the moral materials of their times and their cultures, and sometimes the human condition. But it's an extraordinary thing what poetry is and does. But as experiments, it's worth noting that the great fictions don't cook the books. They do the experiments with profound honesty. And I suspect that certain truths, especially in the area of ethics, are best told through fiction rather than discursive prose, descriptive nonfiction. You know what I'm trying to say. So as long as humans do engage in war and return to domestic life afterwards, I am convinced that the Homeric experiments will offer substantial insight. I am deeply grateful to the classicists who have responded to my observations in these two books, which are my labors of love. In particular, the books examine the social and ethical world of soldiers within the ecology of power in their own forces. My general conclusion is, yes, the enemy does matter. The enemy genuinely is the enemy and genuinely is doing their level best to kill you. And they matter a lot. But in a strange way, what they can do is rather limited compared to what the soldiers' own forces can do in the way of damage in war. And that has been my main line of march. Now the epics, the Homeric epics, can teach us nothing about weapons, planning, communications, tactics, intelligence, organization, training, logistics, any of that. But when it comes to cohesion and leadership and ethics, they still are vibrating to this day and to this audience. It's entirely possible that if the human species manages to figure out how to end this hideous practice, that the poems will become a matter of purely artistic, poetic, and antiquarian interest. But as long as humans make war, I guarantee you they will still have a punch and be read. Now, my pitch to the military is clear and it's simple and it's not new. In fact, in this area, nothing I say is new. But maybe it's the novelty of the bearded psychiatrist saying it that makes it seem new to some people who hear it. And I just want to briefly tell you what my pitch is so that it doesn't hover there as, well, he talks about prevention, but what's that look like? I mean, it's important for me not to leave you dangling. So I say that there are three things that protect the mind and spirit who go into these hideous situations. First of all, protecting them are positive qualities of community in the face-to-face unit, the small unit. Now, I'm not talking only about a fire team of 3 or a squad of 10 or even a platoon of 35. Probably cohesion, as I'm talking about, it does end at the company level, roughly 120 to 150, depending on the force and the organization. So that's number one. Number two is expert, ethical, and properly supported leadership. And you're going to hear a lot more about leadership. And then finally, prolonged, cumulative, and highly realistic training for what people have to do and face. So my mantra to military audiences, whether they're in uniform or in the civilian secretariats or the Congress or the press, is cohesion, leadership, and training. Cohesion, leadership, and training. And if you're a missionary, you have to be really comfortable with repeating yourself endlessly. And I got it. I will repeat myself endlessly on this mantra because it really is preventive. I also try to get across to the uniformed people that all three of these are moral imperatives for people who can do better or do worse on these, because they are truly soul-saving and life-saving in this monstrous practice that we call war. So that's where I'm coming from, as they say, and now I'm going to talk about the specific topic of moral injury. My definition of this phenomenon, which comes straight out of Homer's Iliad, Homer's story of Achilles in the Iliad, is three things. You must think I'm some sort of Trinitarian. All my lists seem to come in threes, but that's mainly a sign of how bad my memory is. A list of 4 is just way too long for me to remember. So 1, 2, 3, all three. A betrayal of what's right. 2, by someone who holds legitimate authority. 3, in a high-stakes situation. Now, of course, the stakes in war, there's no area of life where the stakes are higher, but it's important to realize that nobody ever became morally injured discovering that someone is cheating in penny ante poker. The stakes just aren't high enough. And usually, socially, when somebody discovers cheating in penny ante poker, it's an occasion for hilarity rather than rage or suicidal depression. It is not, so the stakes have to be there. Now, it turns out that my 1, 2, 3 definition also includes the brain, because if all three are in place, the body reacts as though it's being attacked. The body codes moral injury as physical attack. The guts churn, the heart pounds, you get sweaty. You are mobilized for danger when you recognize the occurrence of moral injury in your social world. And having said what I just said, I just want to cycle back and point out that there's the whole human critter here. So the brain and the body are involved. The mind is involved. The social system is involved. And the culture is involved. The code of what's praiseworthy and blameworthy is a language-like code that is in the culture. Every culture has one, and like languages, they differ all over the map. But everybody's got it. There's no human being who's ever had no culture or a half a culture or a fifth of a social system or a quarter of a mind. The brain, mind, society, and culture all co-evolved in the full and rich and strict meaning of that term to evolutionists. They all appeared at the same time when the modern human emerged in the Upper Paleolithic period. Now, that's a whole other story. So, the main reason I am so emphatic about moral injury, especially as I have defined it, it is something we can do something about in military organizations. Moral injury is exquisitely sensitive to policy, practice, and culture in the organizations. So that's been my beat in prevention. I would love to end the human practice of war, but honestly, I don't see that as being something that I can make a meaningful contribution in my short lifetime. I mention this as primary prevention to all military audiences. The primary prevention is to end the human practice of war. And I can tell you, I don't get pushback on that from people in uniform. If they've been to war themselves, in general, they loathe it. Or if they have acknowledged some moments of enjoying it, as many men who go to war do acknowledge, they also have a deep visceral loathing. At the same time, they can remember moments that elated them. So that overall is my prevention riff. Now, I'm going to focus down on the leadership part and another triad. That the leadership part is expert, ethical, and properly supported. And this is especially sensitive to the policy environment. In particular, screwed up incentives in officer promotion and selection for command. And this has been remarked for decades, and it just never seems to change. And there's a lot that we can do to make this stuff better, and I can't take the time to go off in that direction. But let's ask the question, if moral injury has happened to a person, what's that look like? What are the consequences for the person? Well, first off, it deteriorates their character. Their ideals, ambitions, and social attachments shrink. We see that happen in the Iliad. Achilles, we learn, has been a broadly pro-social person with a commitment to the whole army, not just to his regiment. He is revered as a healer of battle injuries. The Iliad is an extraordinary piece as a literary construction in that like its hero, it hits the ground running in Iliad 1. You don't get a long expository preface saying, and Achilles was born in such and such a year in such and such a place, and here were his father and his mother. It hits the ground running, but in the course of this monster poem, we learn enormous amounts about what Achilles was like before the thunderbolts of the opening in the first book. And he was a mature, well-developed, pro-social adult, revered by his soldiers and his fellow officers. And the Iliad is the tragedy of his coming unglued. And that is my spin on it. There have been other spins on it, but I leave that to all of you to explore further. So when a person has been morally injured, their ideals, ambitions, and attachments change and begin to shrink, and it destroys the capacity for trust. Trust is so pervasive in the lives of a reasonably well-located and reasonably fortunate inhabitant of the modern world that it becomes as invisible as water to a fish. But when it's destroyed, people are as deprived of support and oxygen as a fish is that's jerked out of the water and left flopping on the shore. When trust is destroyed, it's not replaced by a vacuum. It's not replaced by nothing. It's replaced by an active expectancy of harm, exploitation, and humiliation. Now, there's, at least in any group of people that I talk about this to, there's at least one person say, well, Doc, don't you mean paranoid? That's paranoid, isn't it? Okay, it's paranoid. But we don't learn one tiny thing more about this human being by hanging the jargon on it. And it's always best to stay close to the phenomenon. And the phenomenon is the expectancy of harm, exploitation, and humiliation. That is basically universal when trust is destroyed. I know it's brash to say something is universal, but it appears to be. So, if that's your settled expectancy, those one or more of those bad things from other people. You don't have a lot of options. And a lot of what we see and have so much difficulty coping with is the reactions to this expectancy. And so I'm sort of embarrassed by all these triads, but there they are. There really aren't a lot of options if that's what you expect from other people. One is you can strike first. I'm going to get him before he gets me. And we meet people like that, some who attack verbally right from the start, less often people who attack physically, but so that's certainly one option. The other is to withdraw and isolate oneself. A great many psychologically and morally injured combat veterans end up out in the woods or in basements or attics, and they're doing this to avoid human contact because they are afraid of what that contact will lead to. And many of them recognize that the most destructive thing it would lead to is for them, the veteran, to do harm to another people, and they don't want to do that. So their solution is to withdraw and isolate themselves. Now, in a certain sense, the Iliad shows that. Achilles withdraws. He withdraws from the army. He isolates himself, and one gets the sense that he is isolating himself not only from the other Greek commanders and the rest of the army, but even from his own troops, the Myrmidons. He says at one point that his world has shrunk just to himself and his foster brother, his second in command and battle buddy, Patroclus. So the aperture through which he's seen the world has shrunk to a tiny pinpoint. It's just Patroclus. And those of you who know the story of the Iliad know that the great blow coming is that Patroclus will die in the war. So those two alternatives, strike first, to withdraw and isolate, and there is a third, which is to create deceptions, false identities, false narratives. And of course, the master of all those is Odysseus, who is an astonishingly fluent liar. He tosses off cover stories. He's like one of these great improvisational musicians who, just given the opportunity, will start improvising something in the style of Stravinsky, totally convincing, or in the style of Mozart or Bach, just blah, blah, blah. And Odysseus is that artistic and supple and creative as one of these great improvisational musicians. And you see that, and some of them are quite entertaining in the Odyssey. Now, we have been carefully taught to believe that stable good character in adulthood is rock solid, as long as you've had the good resources of good genes, what Plato would have called good breeding, and good upbringing. Plato certainly knew that even the noblest parentage could be ruined by a bad upbringing. But if you had those two good resources, your good character, your virtue, your reason would set up as hard and unbreakable and unmovable as rock in adulthood, that no bad thing that ever happened to you in adulthood could break or budge that rock. Well, this is a beautiful idea. It's a terrific idea, and the trouble with it is that it's complete crap. It just isn't true. If it gets bad enough, and bad enough for long enough, even the noblest character can be wrecked, which is indeed the fundamental direction and meaning of Euripides' great play Hecuba, where we see this just glowingly noble character of Queen Hecuba deconstructed, dismantled, torn down, broken down, until she becomes almost literally a dog. And in the world of that place and time, a dog was not something cute and cuddly, man's best friend. A dog was a very unappetizing creature to be. So it was really from the Iliad that I first grasped the nature and importance of moral injury, because my mind had been primed by listening to my patients and trying to understand what their wound was. How am I doing on time?
10 more minutes if we want some time for questions.
Okay, 10 more minutes, including some time. Okay.
Yeah.
I'm going to very quickly tell you what the official diagnosis post-traumatic stress disorder is, and what I'm talking about isn't that. Moral injury is not the same as post-traumatic stress disorder. When other people are really trying to kill you and doing a damn good job of it, and you see this person killed or maimed, you know they're doing a good job of it. The body and the mind and the ability to relate socially undergo an adaptation to that real situation. Those adaptations come in three flavors. One is a kind of hyper-remembering of what mortal danger looks like, and that's the cluster of symptoms that is defined, that defines PTSD, one of the three clusters. A kind of hyper-remembering, like repetitive combat nightmares, intrusive memories, flashbacks. Another adaptation, and it's a valid adaptation, and that's the point, that what is called PTSD is a very specific summary of the persistence of valid adaptations to mortal danger, especially imposed by other human beings. So the second is shutting down. It's an economy move, shutting down of all interests, activities, and emotions and relationships that do not directly serve surviving this situation of other human beings trying to kill you and doing a damn good job of it. The third is the mobilization of the body and mind to meet this danger. And that is the sharpening of perception, the release of adrenaline, the many bodily adaptations to meet danger, increase in muscle tone, etc., etc. This is very widely understood and known set of phenomena. So these three clusters together, it's known as the hyperarousal cluster. These three clusters together define the danger syndrome of PTSD. moral injury is something that can happen alongside of that danger syndrome. It can happen separately from the danger syndrome. They are separate phenomena, and empirical research that is currently going on suggests that moral injury is much more powerful driver of suicidality and domestic violence than pure danger syndrome, pure PTSD. And in my observation, this is not strict research I'm talking here, in my observation, pure PTSD rarely is severe enough to totally disable a veteran or to wreck his life and his family's life. Now, the complications of PTSD, in particular alcohol and drug abuse, danger seeking, and those truly can wreck a veteran's life. But the pure culture of the danger syndrome rarely wrecks a veteran's life entirely, but moral injury devastates it. It also leads to criminal involvement. And many of my patients had been incarcerated, some of them never incarcerated because they had never been caught. That's a whole bunch of war stories that I can tell there, but which I will not at this moment. So, I do want to mention that I have used repeatedly in my speaking with military audiences on prevention that I specifically cite Professor Haubold's monograph, Homer's People, which is about the relationship of the leader to his people. In the Iliad, the word that is used is usually translated the troops, and in the Odyssey the word appears relatively rarely, and when it does occur, at least some of the time, it is the people of Ithaca. So it's the relationship of Odysseus to the people of Ithaca. And boy, don't the various leaders, Agamemnon, Achilles, Odysseus, and actually Hector, all failed their people in their own ways and for their own reasons. But one of Professor Haubold's notable accomplishments in this particular monograph that I've found so useful is to point out that the relationship of a leader to his people is a theme that links the two epics, which famously, those of you who are Homerists are aware that it's sort of a critical commonplace that the two epics have sort of nothing in common. There is some cast of characters that appear in both in one way or another, but other than that, it's as though they have been artificially kept at arm's length from one another. And so in the context of that powerful critical observation, it is an interesting and I think meaningful discovery that this issue of how is power used by leaders, that links the two epics, says something I think of great importance. So I think I'm going to just flip and I want to bookmark for you, as I hope this is done, giving you a desire to go back and look again at the Iliad, to just notice that Agamemnon engages in a twin violation of the army's moral order, just like that in Book 1 of the Iliad. That is the setup, the kickoff for the whole tragedy that follows, is this violation of the moral order of his army that Agamemnon engages in. First, in dishonoring the priest of Apollo, and second, in dishonoring his most effective and most esteemed and honored subordinate commander, Achilles. And so he does terrible, terrible damage to his own cause. Now, I would like to I know that there is at least one physician in the audience. How many other people are involved as clinicians, whether as physicians or any other healthcare professional? I do want to just touch on some of the clinical implications of moral injury. I want you to notice that if the capacity for trust is really devastated, it becomes a hell of a problem in the clinic. And a lot of the damage that this problem can do can be mitigated by being mindful of your own reactions. A lot of professionals who have sweated bullets to get their credentials, their MD, their specialty certification, their doctorate in clinical psychology and the clinical internship and all that hard work, devotion, and here comes a patient who says, "Why should I trust you?" "Well, look at those degrees and certificates." Guess what? In the military, the people who were the source of the moral injury often had impeccable credentials. So it can be a traumatic trigger. Here comes Shay into the waiting room. "I'm Dr. Shay. I'm a staff psychiatrist here in the VA. You're Mr. So-and-so. Will you come in?" Just my introducing myself by my credentials and institutional position can be a traumatic trigger. And so, in general, people are self-controlled enough that I won't get punched in the nose for introducing myself as a doctor. But I might well notice that this person gets all tensed up and I don't know why. And it's so important not to take it personally. To work with combat veterans, you have to earn their trust. And you earn it by showing up and being unremittingly honest in everything you do. This is difficult for a lot of credentialed professionals to take, and a lot of them retaliate. They'll give some disparaging diagnosis to somebody who should be diagnosed with combat trauma. They'll say, "Oh, this is somebody who's character disordered," sort of guaranteeing that they'll be held at arm's length and given very little in the way of disability benefits, and possibly shunned by other clinicians when they see that diagnosis hung on the patient. So another thing to remember, and this would be in all clinical settings involving combat veterans, that they have been in a condition of coercive control that is no less than a prison tier. It is no less than a condition of torture. War is a condition of torture, and it is a condition of captivity. And in that setting, people learn certain adaptive skills, and one of them is playing off power holders against one another. And so when a person who's morally injured runs that number on you, if you're not prepared to really struggle wholeheartedly and safely with your colleagues, I'm not talking about here with the patient, that's another story, but what I'm describing is called a split among clinicians. They'll play off any two, it could be man and woman, psychologist versus psychiatrist, psychiatrist versus internist, mental health clinician against administrator, and they can even involve outsiders like congressmen and the press and their spouses. And before you know it, your head is exploding. And this can really wreck people, and the sovereign cure for it is having a trustworthy community in your clinical setting. And so I'm getting the nod here, and I think that's it, that I'm going to thank you.
The immediate analogy is with children who have suffered from family or other kinds of traumatic disorder. The lack of trust, the minute they come in to see you, is immediate, is apparent straight away.
If you think of the definition, the 1, 2, 3, betrayal of what's right by someone who holds legitimate authority in a high-stakes situation, it of course applies to the family and to small children particularly. They are quite powerless, and they have accepted the society's legitimation of the parental role much more strongly than other people may, but the child certainly does. And if that is betrayed, you get a moral injury in children, for sure. Incest is the obvious example, but all sorts of other bad stuff that's done to and in front of children is mightily damaging.
Yes, question over there.
What would you say are the major differences in the treatment of PTSD versus the treatment of moral injury?
I think that PTSD, as a pure culture, can be quite successfully treated by sort of focused treatments, some of them psychological treatments, some of them pharmacologic, and so on. But it can be done successfully in a clinician and patient format, whereas in my view and the view of the clinical team that taught me, recovery from moral injury happens only in community, and that it is primarily the community of a veteran's peers that is the real lever and fulcrum for recovery. So don't ever try to do this work alone, and don't ever get the idea that your goodwill and heroic self-sacrifice is going to save somebody, especially in a one-on-one relationship. I regarded us, and my colleagues shared it, as stagehands. We got the lights on, swept out the gum wrappers, counted the chairs, and the veterans were the people that belonged in center stage, and they did the heavy lifting with each other. And we just made sure that it was a safe and stable environment for them to do their work.
I was just wondering what you would say about the divergence or the shared ground between moral injury and PTSD and grief, because a lot of people who know the story of the Iliad might say that Achilles' behaviour is because of his grief for Patroclus, but according to your theories, he wouldn't behave in that way if it hadn't been for what Agamemnon had done. So
well,
grief
Achilles' grief is infinitely contaminated both by his own self-blame for having allowed Patroclus to re-enter the fight without Achilles at his side. So self-blame is always it's a frequent but very toxic add-in to the pure grief of loss. The Iliad is amazing in showing us, it doesn't tell us, it shows us that Achilles felt like he himself had died when he learned that Patroclus had gone down. And how many times I heard that from veterans. Doc, I died in Vietnam. When so-and-so was killed, it's like I died at the same time. That's real. That really happens. And the Iliad shows it amazingly.
I think on that note, we'll probably have to wrap up, but I'd like to thank you very much.
My
again
great
for
great
this
pleasure.
talk and your